Hello, my name is Azadeh. I am going to talk about correlation of mammography and ultrasound in diagnosis of breast cancer. First, we're going to talk some introduction about the breast cancer. There are multiple types of breast cancer. Three most common types of breast cancer are ductal carcinoma in situ, invasive ductal carcinoma, and invasive lobular carcinoma. For prevention of advanced breast cancer, the annual screening is being recommended to the women with the risk factor. And for diagnosis, normally ultrasound, biopsy, or surgery is used. For the screening of the breast cancer, as I said, mammography is used. Mammography is a low dose of X-ray, and it has two types, film screen and digital. And when the mammography is being done, the radiologist is going to take a look at the images. They're going to stage that breast from with the BI-RADS, which is breast imaging reporting and data system. And it's from BI-RADS 0 to BI-RADS 5. BI-RADS 0 is when the image was not diagnostic and should be repeated. And BI-RADS 5 is when pathologist, after the biopsy has been confirmed, the malignancy of that lesion. So when the mammography doesn't find any lesion in the breast, so it's BI-RADS 1, which is negative. The patient is being sent to for the next year, come back for the annual screening. And then if it is BI-RADS 2, which is probably benign, but they want to confirm it by ultrasound or sometimes by MRI. So they send the patient to the ultrasound for further evaluation. But in order to confirm the location of the mass, they use some methods of locating breast mass. So there are three types of locating breast mass. First is 4 quadrants, which is breast is divided to 4 quadrants, and they are called upper inner, upper outer, and lower inner and lower outer. So, and then the other type that they do is o'clock type, which is, for example, if it is upper for example, right breast, upper outer, it can be from 9 o'clock to 12 o'clock. And then they want to decide if it is upper outer right breast, which o'clock it exactly is. For example, if it is 11 o'clock. And then after that, the next part is the centimeter from the nipple. So if the right breast is upper outer and it is 11 o'clock, and now we want to know how many centimeters from the nipple it is located. For example, 2 centimeters from the nipple. And then with these type of locating the mass, now the ultrasound tech knows where to exactly to look for the mass. Okay, so now the exam has been changed from a screening to diagnostic. Diagnostic exam of the breast mostly is done by ultrasound. Also, they do mammography in some places and they do MRI, but then mostly ultrasound is the most common use for diagnostic exam of the breast. So the ultrasound is a machine using sound wave. It's non-invasive, doesn't have any radiation, and is actually more comfortable than mammography. And it characterizes the lesion that is seen on the mammogram. And if the lesion is cystic or is solid, the ultrasound decides, and then with the color Doppler, they decide the blood flow up to that lesion. If there is any vascularity or there is no vascularity, they decide all of this with the ultrasound. So if, for example, the lesion is cystic and doesn't have any vascularity, so this is benign lesion, and it's BI-RADS 2, and the patient is being sent for follow-up in a couple of months, or sometimes if the cyst is big, they might want to drain the cyst. But if there is a solid lesion, then the patient, and then there is vascularity, the patient is going to be sent for the pathologist, for the biopsy and evaluation with the pathologist. So this is something that I found useful. I found it in an article, and the image A shows a 70-year-old female with palpable lump. She went to the mammography for annual screening, and that white lesion was found in mammography. Then they sent the patient to the ultrasound. And ultrasound, the lower images are the ultrasound images, and then you see that it looks like a solid lesion, and it's not cystic, and it has vascularity. Those color inside of the image shows the vascularity, so it is probably benign, probably malignant, which is BIRAT 3. And then they sent that patient to do the biopsy, and then mostly biopsy is being ultrasound guided. So they guide with the ultrasound, they guide the needle to exactly sample the mass at the right location. And the result of the biopsy came out invasive ductal carcinoma, which is malignant. And then the next image shows some lesion was found in the mammography, and then they sent the patient to the ultrasound, and it was totally cystic, and it's just benign, and they just send the patient for further follow-up in a couple of months later, and to make sure that doesn't increase in size. So in my opinion, this is very effective way of prevention of breast cancer at advanced stages, because mammography, I know it's uncomfortable, it's painful for some women, and also it is using X-ray. I mean, it is using radiation, but it's low dose of radiation, and it's really fast. So for the screening of more women at a shorter time, it's better to use a faster way, and it's more actually more appropriate way of scanning more in women at the shorter time. But then the ultrasound is more expensive, and it's also actually it is more comfortable. Some women prefer ultrasound for screening than mammography, but it takes a lot of time, and it's not actually recommended for a screening. So for my critic, I believe that this is actually a very good way of because ultrasound complement mammography, and they work together really tightly in breast cancer. In breast ultrasound department, and they work tightly, and they can detect by mammography, and they can find more information about the lesion in the ultrasound, and also after biopsy. So I believe this is really good correlation between these two, and I think this is faster and more appropriate. And these are my references, and thank you for listening to my presentation.